Good evening. Welcome to the Stormont Vail FaceTime Live community conversation about resiliency and recovery. Tonight, we're going to be discussing about how the last year has impacted all of us, both as individuals, but also the industries in which we work. We have a very impressive panel whose respective industries have been through so much, and they will have a lot to share throughout the upcoming hour. We'll start with some general reflections from everybody and then have a group discussion. I'd like to first introduce Brad Chapin, and as I introduce you, maybe raise your hand so people who are joining in can identify you. Brad is a director at our Stormont Vail Behavioral Health Center, and he's an expert on resiliency and recovery. And he'll shed some light on how, in his experience, people over the past year have been affected by the pandemic, both as individuals and bigger communities. I'd also like to introduce Brenda Mills. Brenda is the CEO of Family Service and Guidance Center, an organization that provides mental health services for children and families throughout our community. Her team has seen firsthand what people have been through over the past year, from our very youngest through adolescents and young adults. So welcome, Brenda. Educators across our country have had to quickly shift not only to how they are educating our students, but how they're also supporting them and their overall well-being. Dr. Tiffany Anderson, the superintendent of Topeka Public Schools, will be sharing information with us tonight about how her school district has dealt with these extraordinary challenges. Welcome, Dr. Anderson. At the beginning of the pandemic, we all learned really quickly about how this past year has changed our businesses, both large and small. Many have had to close or completely redesign their business models. So Curtis Sneden, president of the Topeka Chamber of Commerce and senior vice president with Greater Topeka Partnership, is here to share information about how the business landscape has changed, both for the hospitality industry, for different businesses, and for the overall economy. So welcome, Curtis. The COVID-19 pandemic unquestionably altered overall public health. Dr. Erin Locke, Shawnee County Health Officer, is here to talk about what we've seen over the past year, what steps we can continue to take as we help stop and what to expect in the months ahead. Lastly, I'll introduce myself. I'm Mary Martell. I'm the Director of Research Services for Stormont Vail Health. Like all fields, the clinical research industry faced significant challenges over the past year. Most notably, many clinical trials were halted, from routine pediatric vaccines to potentially life-saving cancer treatments. We also witnessed, however, remarkable opportunities in the clinical trials field. We all marveled as new coronavirus vaccines and treatments were tested and developed and made available to us. We had a direct experience with that here at Stormont Vail when we became one of the participating institutions in the Mayo Clinic Convalescent Plasma Program, expanded use program. Today is the 7th anniversary of Stormont Vail becoming a Mayo Care Clinic Network member. And it's because of that membership that we were alerted really early during the pandemic about the Mayo convalescent plasma. We treated the 44th person in the world with the convalescent plasma, and then 60 additional patients of the 70,000 who ultimately received it before FDA approved its emergency use, making it widely available. So that's the real scientific and maybe clinical side of this past year in the pandemic story. But we're here to talk about the greater story tonight, which is the more emotional side and the human experience. How we're doing, what we've been through, and how we've experienced this maybe more with our hearts and our minds. So to start things off, Brad Chapin will be talking to us about resiliency and recovery. So.
Thank you, Mary. I just wanted to first say, I think it's things like this that really help us manage and get through these tough times. I want to thank everybody for being part of the panel and formally setting aside time to kind of reflect on where we've been over the last 12, 13 months and where we're at right now. And then also, what we have to hopefully look forward to over the next few months and into the next few years. So from a psychological perspective, I've spent the better part of the last 20 years really studying how people manage challenge in their lives. So although this is not how you'd want to draw up a study, it's been, fascinating for me to watch and be part of this, and then to sit back with people from different professions and different experiences to talk about how this is impacting them and where they think that we should go. So I'm really excited about the next hour or so here. It seems most important, though, as we look through to challenges and threats in our lives, that we're generally pretty good at it as human beings. That's one of the things I love about studying people, is that we're really pretty good most of the time at managing challenge in our life. And I usually say in my talks when I'm working with people, if you haven't had any challenges in your life, you can go ahead and leave right now. But for the rest of us, there's a lot to be learned from moving through challenges. And I don't think there's anyone, at least in this panel or that I know of, that hasn't been challenged by COVID-19. So it's a universal situation. That's one of the things I think that makes it different. I was going to talk about a couple of things that makes COVID a different challenge than what we're maybe used to. Usually human beings are built to respond to challenge. We have the tools to be able to do that. And then we take some time to recover, and then we're ready for the next challenge to come along. And that's kind of how we go through life, these ups and downs. COVID really hasn't allowed us to do that for a number of reasons. Number one is the scope and just the breadth of COVID and how it's impacted us, at work, at home. There's really, sometimes you feel like there's no escape from it. It's our family and friends. It's changed the way we do business and interact with folks. So just the scope of that challenge is enormous. It's universal. There isn't anyone that hasn't been touched by it in some way. The second reason I think it's different than just typical challenges is that the intensity of it. It's a physical challenge and it's a social and emotional challenge, which is unique. There are threats, physical threats, to dealing with a virus that can impact us physically, and then all of these emotional and social challenges that come along with that add a whole new layer for us responding to that challenge. And then just the duration. This has been going on for over 12 months now, and most of the research out there says that if you've been dealing with a significant challenge for 21 days or more, most of us average human beings, we have exceeded our abilities to cope really well with that, if we haven't had time to kind of take a step back. And so we're starting to really see and hear some of these stories about burnout in the news. I know I've seen several of these stories with healthcare and education and these different fields really talking about burnout. It moves from what we call the stress of a challenge to something called strain. And those are two different ideas. Strain is something that we talk about when our resources have been exceeded. And so when we start to enter into those areas, we really, really have to look to each other and to the literature and to think of new ways. How do we add back into those resources? That's really what we're talking about, so that we can continue to manage. And that's why I love this term resiliency. That's what we're really talking about, is how do we add back into our ability to cope and manage through these challenges. Sometimes I use this analogy of, so how heavy do you think this bottle of water here is? Maybe a pound or a pound and a half. But what if I've been holding it out here to the side for 2 minutes? Or what if I've been holding it for 2 hours? Or what if I've been holding it for nearly 13 months out here to the side? Gets really, really heavy. But then we also ask sometimes, what if I was to set it down and walk away from it for a few minutes and add back into that resiliency, and then go back and pick up that challenge again? It goes right back to the original weight that it was. And so a lot of times what we're trying to do with resiliency and recovery information and education is to help people understand, how can I set that down for a minute, so that I can recharge and get away from it and go back to it. And I don't want to get too far into that to start with, but I did just kind of want to put that out there, that when I think about resiliency and recovery and where we're headed, it's hopeful to me, because we do have things that we know from science and research that really we can have an impact on that piece. And everybody has a personal experience from this situation. So I just, again, want to thank everybody for being part of this discussion. Talking about it is how we cope and how we express our feelings and thoughts about it in healthy ways. So I appreciate that. Thanks, Mary.
Thank you, Brad. A lot to think about. And I know in addition to helping patients and others in the community, you've been helping those of us at Stormont Vail and our unique experience in a healthcare setting, helping us hold up that cup and take a break from it. Really interesting. Next, I'd like to welcome Dr. Locke, and for you to give your insights from a public health perspective.
Thank you. And I'm really happy to be here. It's a true pleasure. When I think about the past year for our public health system, I think the hardest thing for us is that we have often been perceived as that water bottle that everyone is holding for the last 12 to 13 months. And when I say that, I mean that what we are really trying to do is help people hold that water bottle, but we are often taken as the problem, as that water bottle. And I think that is really what has driven quite a bit of the burnout and the stress within our health department, both locally and state and national. And we've seen quite a lot of turnover, even right here at home, of individuals who are new to the health department, replacing people who have left because of the pandemic. And I'm one of those. I'm one of the turnover, one of the new faces. And so I think that's when that would be sort of my summation, is how difficult it can be when you are perceived as the problem instead of part of the solution.
Thank you, Dr. Locke. I think of the expression a project or something being a heavy lift. And again, just holding up that cup. So we're glad you're here. Thank you. Brenda, would you share additional information about our children and families and their emotional and mental health?
Yeah, so, in the mental health world, our job is to provide some stability and some hope to the children and families that we work with. And when you go through a period of disruption like we had this last year, not only are we having to do what we can to help the families, but trying to keep our staff secure and feeling that they can, they all had their own issues to deal with at home. Children, a lot of our staff have kids in school. So it's been a big challenge for us. We had to, on a dime, turn into a telehealth system, and some services that we provide face-to-face couldn't be provided with a telehealth means. So that was a challenge for us, as we knew there were some things that we were not going to be able to do, and trying to find the way for us to be able to do what we could to ensure that the pay sources would pay for it, to make sure that those services that we were providing in person, so our crisis services and a few of our other particular services where it really can't be done any other way. We had to make sure we had enough PPE and safety supplies and those sorts of things, as every employer did, trying to set their facilities up. Technology was a big challenge for a number of our families. And as it was for us as an organization, we had plenty of technology, but not at home technology. And so sending everyone home to work from home was a big lift. And then finding out what kinds of gaps our families had, and trying to compete with the one computer that might have been in the house when it was needed for children in school, or maybe their parents. And it was a little bit of a challenge for everybody, but it worked. We're finding our way, and fortunately we're starting to see families back in the office. Our staff are back in the office, and you can just see you can just see things being uplifted. And I'll talk a little bit later about some of those kind of steps on where we think things need to go for resilience for our families. And
just working from home and the number of people whose workplace changed so dramatically. I worked at home for quite some time, and it was so isolating
mhm.
and such a significant change. So I'm sure that is part of the overall emotional well-being story.
Yes, when we're a group of people who are businesses interacting with folks, Zoom has been wonderful. At a point in time, Zoom is just not the same. And so seeing people in person, many of our providers wanted to get back to the office and see their clients in person, even when it wasn't quite safe. So we had to wait for just a little bit, but things are moving along now.
Brad, would you like to add anything while we're on the topic of community mental health before we move on?
Well, yeah, I think when it comes to kids, when I was talking about resiliency, man, they are a resilient bunch, and working in mental health, you hear a lot of different stories and not always the most positive, but wow, that group of kids, sometimes when I go home, I have three children too, I sometimes feel like they're doing better than I am many days, and it's encouraging to see that for sure. But, I think there are quite a few, and there's a lot of tips and tricks out there that we could talk about, but one of the most impactful things I think, is in a world of uncertainty, in a world of unknowns, anytime I can add a little bit of predictability, and this isn't just for kiddos, this is for anybody, but it's just that seems to help, with that, because they've lost a lot with the structure and routine. That added a lot of predictability. And so anytime we can help with the knowns versus the unknowns in a kid or a system, family system, business system, doesn't matter the system, if we can interject some predictability, a lot of times that can help offset some of the unpredictability that somebody's feeling. So that's just one of those things I like to throw out, especially in working with kiddos. A lot of power and predictability when you're in uncertain times. So.
Thank you. So Dr. Anderson, this question seems too small or maybe too simple when considering what our educators have been through, but how would you describe the last year, both for our students and for our educators?
The last year has certainly been a challenge for us all, but one that has created some new opportunities to build systems of support for young people and adults. Truly the good work from Dr. Locke to Ms. Mills in terms of partnership, you reflect on the fact that we're not in this alone. We can't do this alone. And you really have to rely on partners. Stormont Vail has been one of our largest partners in many different ways, even Mayo Clinic. And throughout this piece, when we come back to this, I'll post some research from Mayo Clinic on just resiliency, isolation. And so, really, when we look at this whole year, of course, Topeka Public Schools, we are a diverse district, but we're a district that has both a mixture of students on free lunch and students who are not. And so students who really are asked to have this heavy lift and not have the resources, it's been really important for us to be that stability, to ensure that we can provide the resources that we can in ways that just really wrap our arms around our kids. The other piece of that is developing skills so that young people can not only function through the pandemic, but readjust after and during the pandemic. And that's what we're talking about tonight, that whole piece of resiliency. And so Topeka really has been focused on trauma-informed care, being trauma-informed, prepared and equipped, and knowing really what to do when kids come back. And we're excited about that. The last week, all of our middle and high school students returned full day, 5 days a week. And the animal therapy dogs, we have 15 of them, stood outside and greeted the young people to come back in. And while we kind of smile and say, what, animal therapy? Those kinds of things have been really important. Making sure that young people have ways to connect, express themselves, and that our staff have the resources to do that for our young people, but also for themselves. So it's been a year of challenge, but also truly a year of opportunity.
Wonderful, thank you. Curtis, to wrap things up, what are your reflections on the business community? I know just as a consumer in this area, I've seen so much creativity, some frustration and and empathy for businesses as they've struggled, but also a lot of creative solutions.
Well, I'm looking forward to delving into that as we go along. But what I would tell you is that what's been so fascinating about the responses thus far is that they establish, in my mind, a very clear continuum. It might be tempting to categorize issues as business issues, family issues, individual mental health issues, education issues, but everything the previous speakers just said can all be restated in a form relative to the experience that business owners in our community and presumably all across the world have had this year. You talk about that stress translating into strain when we exceed our resources. Well, that's precisely what some of our businesses were doing. They were tearing through their reserves. They were doing everything they could to access relief dollars that were coming from the federal and state government. You talk about predictability. I mean, that is the main premise upon which private enterprise is constructed, is the predictability of a system of laws, et cetera. And this has been a very unpredictable year. So I think it's quite fascinating that when you come to the chamber guide, we aren't going into a whole different universe of concerns. They're really very, very similar. One thing that I would note that struck me early on, a lot of it seems a little obvious in retrospect, but this thing did not hit all businesses the same way. It didn't have a uniform impact at all. Some of our businesses were disrupted in a way, but their business model wasn't threatened. Some of our businesses, on the other hand, restaurants, bars, the hospitality groups, the venues, faced an existential threat this year. And to them, this was a whole different type of experience. There were some elements that I think that were probably universal or somewhat generic. The closing of the schools posed a huge issue to the kiddos, to mom and dad as parents, but also to those parents as employees. It really put a lot of strain on people's ability to do what they needed to do to earn their living. We saw a lot of strange, often kind of hard to explain disruptions in the supply chain. And we found out how vulnerable our global supply chain is way early on when we discovered it was going to be a challenge to get rubber gloves of all things. I mean, I think that turned a lot of light bulbs on in people's heads. And then to Dr. Locke's point, I don't know whether one forum can get at this thing, but we discovered some profound differences of perspective in our relative communities, didn't we? And it proved pretty close to impossible to reconcile those differences sometimes. I'm hopeful that before this is all said and done and the history books are finally written, we've had a chance to circle back up and try to figure out why it is that we found ourselves with so many different fundamental senses of what was real and what wasn't this year. I would say that was interesting, but interesting is a little bit objective. It was actually pretty heartbreaking sometimes, and I hope that among all of this is far behind us. So.
Thank you, Curtis. It is really evident how shared our experiences are, and still how often you hear people say, did that really just happen? There still seems to be a little bit of a inability to just believe and to accept what we've all been through in the past year. But you're right, all of you are right. As we get through the strain and move towards recovery, that's where there's hope and all the new opportunities that we've talked about. So I'm going to introduce some questions for group discussion, and for people watching on Facebook, feel free to propose some questions as well. Let's begin with what you think is most important in our recovery in the year ahead, really looking at 6 months to a year. And Curtis, will let you kick it off.
If it's okay with you, I would like to give you two types of thought here. And the first one I think you'll find is obscure, but it's actually mainly for Brad, I think. And let me just throw this out there and let's see how it stews a little bit. But I don't know about all of you, but I have a number of times this last year walked through downtown and come across a door that I'd gone in 2019, maybe to take square dance lessons or whatever at the Jayhawk Theater. And I will tell you that my heart gripped up with something like what you might call genuine sorrow, that all of this time and momentum has been, well, the time has been lost. The momentum, I hope, has just been put on pause. So a question for you to maybe play with here would be, this sounds morbid, but is there a space for our community to officially stop and mourn some of what has been lost? I'm the Chamber of Commerce guy. I'm supposed to be smiles all the time, and I usually am, and I'll get to that. But the idea of formally acknowledging what we've been through and what's been lost strikes me as the sort of thing that could be healthy for our community's mental health. So let me just park that out there, and maybe we'll see what you think of that. On a more tangible level, what I would say is that this community needs to start seeing visual demonstrations that we're getting our momentum back. We need our restaurants to be opening. We need our stores to be opening, all safely, all within the appropriate confines. But I think as we start to see more and more activity downtown and elsewhere, consumers will start to be more confident, and we will come out to start enjoying the sunlight more. We need to make sure that we don't forget our small businesses, because I'm telling you, I've just been on the phone with some of our small business members. They're still deep in this thing. It's tempting to feel like we've come out the end of the pipe. They haven't. They're still deep in it. And finally, we've spent some time, targeted time, with some of our minority business owners. And I personally have had my eyes opened, and I think some of the folks in my universe have also had their eyes open as to the materially different type of experience that those business owners had, and ways we ought to think about handling this next time, if God forbid there is a next time. Sorry about the phone. Thought I had everything turned off.
I could jump in on that first question, Curtis. I don't know. Are you sure you're not a psychologist, part psychologist somewhere in there? Wow, you really hit the nail on the head there. And I had part of that as in my intro, but I skipped over it. You know, this whole idea of a balanced view of what we're doing here and not skipping over the past. Even though we want to so badly just get to what's next. I don't know if you saw, well, I think it was on Facebook. It was on WIBW, the news the other day, of the memorial that Stormont did, you know, that and I think other places are doing this too. You're absolutely right. That as a human being, as part of being able to move on, you know, what I always say is that there's healthy ways to cope and healthy ways to manage through something, and there are unhealthy ways to do it. And so if we don't do it the healthy, you know, we want to try to do it the healthy way. And what you just said there, by acknowledging it, by validating the losses that people have had, I think that's part of what we want to do today with this session, you know, just to acknowledge that has to be step number one. But I also do think that there's ways to formally memorialize some of the things that people have been through. It's so personal to people this last year. You can't, there's not one thing that everybody could talk, but everybody knows they've been impacted. And so I think that's the nice thing about that, is that something we all have in common, and we can all share in that loss and that grief together. But you're absolutely right. I feel like that's got to be step number one. Usually is, and moving through something is acknowledging it, for sure.
I could add in here, Mary, that as our community moves forward, I don't want us to forget the positive things that we forged during this time. And I know that Dr. Anderson and the others have touched on this, but that's one of the beautiful things that I have seen from my view, is that the health department has been working with the hospitals and has been working with the schools and has been working with the businesses, and like for what I think is the first time in a long time, we're all very aware of each other, and we've made these connections. And I think we've also made these connections, as Curtis was saying, in a different way, that our economy doesn't do well when our schools are not doing well, when our childcare is not doing well, when our health is not doing well. And recognizing that now, I would like to see us putting our resources and our efforts into those spaces, into what we know we need for our community and our economy. Because we're all in this together. We really are. And what I don't want us to do is go back into our silos and be like, well, it's over, doors are closed now, but that we keep this communication and dialogue and work, that we keep it going, that momentum that Curtis was talking about.
Yeah, if I might leverage on that a little bit, Mary, that's exactly one of the bullet points I had for things that we want to try to keep. Is we spoke in terms of collaboration prior to all of this, and certainly we were collaborating, but this drove that sense of kind of we're all fish in the same fishbowl thought to a whole new level, and that would be a shame to just let that go. We should be deliberate about keeping that mindset.
Just to piggyback on that just a little bit, one of the items about mourning also requires time. Creating spaces and places where people have opportunities to collaborate, have conversation. It is interesting how often we presume people are listening, but that true piece of taking time to listen to the impacts, to issues, to challenges, I don't know that we do that enough. As Mr. Sneden shared a little bit about his own connection with the business community, the minority business community, and others that have always been there, but the opportunity to have that conversation. Or when we think about the pandemic and those impacted from not having broadband, well, that was always there. But now there's this intentionality about listening to it and then saying, how do we gather together and partner to really address these issues? So you had the library opening their space and all of these other places opening spaces. And so that whole piece of mourning and acknowledging what we've just been through also requires intentionality of time and giving time to be able to do that. And so that communication, I look forward to that continuing now and into the future.
What occurs to me is how much we've learned. And I hear that woven into what all of you are saying. We've talked some about opportunity and about what's ahead. And Dr. Anderson, you used the word hope. What can we be hopeful for? I'd like to talk about what parts of the pandemic you would like to keep around, what you hope will become a new norm, from the importance of coexisting and collaborating to some of the things we've learned from a scientific and behavioral point of view. So perhaps Dr. Locke, you'll have some things that you would like to stay around.
I have a couple things I'll talk about. The first one is, they say things like this, like pandemics really reveal sort of the root inequities and disparities and such in your society. And just to, what Dr. Anderson was saying and what Curtis was saying, that's what this pandemic has really done. It has showed us who always gets the short end of the stick in our community. And so with that, we have had more like impact on actually making equitable changes. And we've had more focus on data and actually trying to build those bridges so that we can make our future community much more equitable. And so that is one of the things that I really don't want that to go away. I want us to continue to think about that. I want us to continue to think about how the history of our country and our racism and our systemic our systemic barriers, how we can continue to break those down. And so that's kind of one thing that I just want us to keep going from a pandemic standpoint. I'm still the health officer, still looking at all the data, and I really want us to keep our eye on the ball. That I don't want us to, and this is what I keep saying, I used to be a runner, and I never won a race by stopping short of the finish line. You know, I never won a race by slowing down when I saw that I was ahead, you know. And that's what I really want us to be thinking about now, is that we can see the finish line, we can see the hope, and we can see that we are finally pulling ahead, but we're not quite there yet. And so what I really want us to continue to do is just all the things that I've been saying, or we've been saying all year, that you can recite in your sleep, you know, the wearing your mask and social distancing. But really, most importantly right now is to get the vaccine, because that is really going to pull us to that finish line. And we're going to be able to do all the things we're talking about now, if we just keep our eye on that finish line and get our vaccine, wear our mask, social distance. We'll finally make it.
Mary, I'd like to share that as far as changes that we've made that I would like to see continue is making best use of this great technology that we have and using it for good, and that it really is a bridge for some of our families who maybe have additional challenges, but also just new ways of doing things. And I think that's one thing that we will take. It used to be that we felt like people needed to be in the office, and they really don't. And for some kids, they actually responded better to a technology means of therapy. And we had opportunities. We had families that were more involved in their sessions because they were right there. They didn't have to take off work because they were working at home. So there's some really cool things that have come out of this pandemic. We had to work extra hard for assertive outreach for children and families who'd maybe fallen off the radar, who weren't attending their mental health services, and they also weren't attending school. So we really had to go out and dig and find folks and get them connected back up with the schools and make use of donated iPads and those sorts of things and really engage people. And we did that before as a community mental health center. That's the kind of work we do, but this was on a whole different level. And I think it gave our staff an appreciation for the kind of work, the boots on the ground work that's going to be needed next going forward. And just continuing, as you guys have mentioned earlier, I'm so sorry that this is, I don't know what's happening to my lighting in my office. It's like I'm fading to black here, but all of the work that we've done with other providers in the community and with the schools, everybody pulling together has just really been eye-opening and shows us what we can do. I did want to mention that for kids, when we're talking about resiliency, we kind of have coined 3 Ps: patience, positivity, and practice. And just kind of going back to some of the things we said earlier, I don't want to take us too much off topic here, but just that families and kids have been in survival mode. If we just can be patient and be realizing that everybody's going to move on this path at their own pace, and being positive, it's very difficult when you're dealing with all this to stay positive with all the negativity and some of the negative press and things that are out there, some of the things that Curtis was speaking of earlier, where people are not sure, what do I believe? But if we can just infuse positivity, this is, I think, part of the rebirth of our communities, is that modeling healthy coping skills, having a sense of humor, autism, caring about others, and helping children to find their own strengths in dealing with adversity. And they will soon learn that coming through this, they have skills that they didn't have before because they've had to go through some real challenges, and practicing stress management skills, those things that we learn from going through stressors. But this helps kids to teach that they can expect stress in their lives and that they can respond, build self-confidence, practicing these skills on a daily life basis is really something we can all do. It's really not just specific for kids, but it is something I wanted to get out there for you all to think about.
Well, it's certainly making a lot of people resilient. To your comment, you also mentioned technology and providing services in a different way and to different groups of people. I heard Dr. Carnegie, our CEO, speak this morning, and he was talking about telemedicine. And before the pandemic, we had conducted less than 50 telemedicine visits. And now it's exceeded 50,000 or something. So it's just, just such a mind-blowing difference. Dr. Anderson, I'm so intrigued by the technology challenges with students. What parts of that do you want to hope stick around, or you're ready to move past?
Well, and I will share that I love this conversation of hope, because hope-filled communities really do lead to communities of promise and opportunity. You have to acknowledge kind of where you are, but look towards what does tomorrow bring. And so for us, reality was that we, fortunately, we were already one-to-one in our devices, our technology. But, reality was we had students, both free lunch and not, that used them in different ways, and in homes that potentially, if you had a kindergarten or preschooler, the child may be a daycare, and how are they going to get online? And so we created just a variety of opportunities, and it started with learning from others as well and researching what others are doing. I mean, think about it, 168 million children globally were shut out of school. And I say that global impact because people are watching what's online. People are looking at how this is impacting all of us around the world. So the first comment of "you're not alone," and we're not alone. And so we launched our micro schools, and were able to open classrooms with 10 to 15 students per class. They're still operating now. That was for elementary. So they were open full day, 5 days a week. And we've done everything from having computers in one classroom, like my class of 10 might be a technology set up, and then Dr. Locke's class of 10 might have technology set up, and our students would still interact with one another through this technology that we have set up within our classrooms. We're actually exploring right now drone technology to deliver packages to families. We have our robotics equipment, in which robots can be the exchange for families as opposed to just students. And at TCALC, they created masks, donated them both to Stormont, St. Francis, right at the beginning of the pandemic. And so it's really taking every teachable moment, because that's really what project-based learning is. We're in a pandemic. What can we as a community learn, and how can we adapt? We turned our school buses into Wi-Fi mobile units parked in different areas of the community, where people could just go anywhere where there was a school bus in the community, and suddenly they could be on their laptop. I mean, so just all of those were opportunities, and I trust those things will continue to stick around. I mean, even this summer, we're providing extended school year virtually and online. Our graduation will be virtually and online, because here's what we've learned: that there's no one way to learn or to teach. And so we certainly see and knew always that there were many ways in which young people learn. But what we've also gained a greater appreciation of is that that way may include telehealth. It may include remote learning. So next year will be our first full virtual elementary. We launched it as a pilot for 4th and 5th grade. We know that students that are immunocompromised or that have anxiety about being around people really did thrive in the environments that they had, even half day. So just that continued opportunity to learn from the experiences and transform. And that's really where that hope is. What are the things that we can use to transform into the future? But none of this could have been possible without our partners. Literally, from the robotics end to the telemedicine, the partners have been instrumental. And so it goes back to, you're not in this alone. And only by being a community that's connected will we transform. I always say, how you take care of your most vulnerable, that's your children and your elderly, says a whole lot about who you are. And what we know is we use the hashtag WeAreTPA. And Topeka, I think, really rose to the challenge in some ways that, some communities may not have. And knowing that there wasn't just one way. Our rural community was different than our urban residents in Topeka Public Schools. And being adaptable, which is what that whole resiliency piece is about, adapting to the current circumstances, learning from it, staying hope-filled, and not seeing this as a problem, but every challenge is an opportunity. It's been quite a year, and we are excited about building onto this for next year, including our robotics platform and technology. Because if students had any question about technology and the use of it for the future, my goodness, did this year not teach us the many opportunities in terms of computer science and technology for the future.
There are so many things that you all could talk about as a result of your comments. How we've all responded individually, but we've also had this connectedness, and that it's time to transform. Curtis, you mentioned maybe the need to have a community-wide marker, some sort of a day to put the past year behind us and to move forward. What do you think of that? You might have just volunteered to do something.
The problem with that is that the Chamber of Commerce is not in the business of running communal funerals. I think that's a bona fide concept, and I'm all for it. But there are probably people who understand that better than I do. I'm really in the business of hope and looking forward, and that's what I'm so enthused about. Way early on in this thing, some of the proudest moments came in the darkest times, when I would go stop by one of our members who was a restaurant, and they had come up with some new way to get their lunches put together and delivered. And they weren't, grudgingly complying with some new health restriction. That wasn't the point. The point was that they knew the environment had changed and they'd better adapt or they weren't going to survive. And they did adapt. And there are innumerable examples of that across our economy that made me proud every time I heard about them. And I'm among the things that I hope don't go away is that sure knowledge that we have the ability to adapt. We might not have, those might not have been muscles that were particularly limber until they needed to be, but I'm very proud of that. It's also true that I think, just to get back to the social disparity question, one of the things that to me is one of the most profound possibilities here that I personally have no intention of releasing my grip on, and I hope nobody does, is that this conversation has been open. It was possible for decades, 100 years or more, I suppose. But frankly, in 2018, if I had wondered about how minority-owned businesses might have been treated differently under federal programs, there would have been sort of a process of getting into that conversation and whether it was okay to get into that. Process is over. The conversation is on, it's open, and I fully intend for us to continue that discussion to the end that everybody in our community has the same opportunity to prosper. That's what the chamber is trying to cause. So I really treasure that. I'm not sure if I'm getting that across very succinctly, but I've had a number of conversations recently, and it struck me this would have been a different. I'm not sure how this would have been gotten at just a year and a half ago. So I'm very pleased with that, and hope that continues.
Yeah, I gotta say one thing before we move off of that question is just, I didn't want it to take a pandemic to do this, but the focus on mental health in the last several months has just been more than I think I've ever seen. It is a little bit sad that it took a pandemic to do that, but I hope that focus continues, because, you know, as some of the physical threats dissipate, the emotional, like we talked about earlier, some of the emotional impacts are going to go on long after. You know, there are certain things that happened over the last 12 months that a vaccine isn't going to take care of. And so the other thing about the mental health system was not in great shape before this started. If you remember back where we were actually just getting numbers from the CDC about our child and adolescent suicide rates being at 30-year highs. And that was before the pandemic. So some of those numbers lag. So we don't know exactly where we're at now, but I don't see that as improving. But what I am encouraged about and hopeful about is that there's been more focus on mental health and behavioral health, and supporting and connecting to each other, and some normalcy around some of these things that we're experiencing. And I feel like there have been people who have been more willing to talk about, you know, some of those stigma reducing pieces. So I think that's been one of the good things that have come out of the last struggle. I also really want to acknowledge the telehealth has been great for us too, and for our patients in a number of ways. So what Brenda was saying earlier is absolutely true. And I hope that access continues for people that didn't have the greatest access before. So thanks, Mary.
Mhm.
You know, if I can just piggyback that piece on mental health, you know, the National Counselor Association for just school-based counselors, you know, give a ratio of 200 to 1 is what schools should have in terms of counselors. There are very few schools in the nation that have that or less than that. About 5 years ago, Topeka Public Schools, we ended up increasing our counselors, 2 per every school, and many have far more than that, but we're below 201, and then added social workers. So now we have 40 and have a whole mental health team. But that is what should be. I mean, that shouldn't be the exception. That really should be the norm. And so to the point in terms of sustainability and systems that really address mental health, not as a reactive thing, but as this is who we are, and a proactive thing. Even good self-care for adults is significant as it relates to that. It's, you know, Topeka Community Foundation, both which Mr. Sneden and I are both on, you know, we've taken on social determinants of health as part of what the private-public partnership is. And my hope is that more private-public partnerships are doing that. Advisors Excel just added on a mental health piece to their own department. They just hired our coordinator for social work, which I know they're adding that department. And so, but how amazing if every place had that strongly in place. We'd have more well-adjusted adults, more well-adjusted children coming to schools, and we'd be better and more healthy as a community. So to the point that was just made, I think it's critical, and all of us with what we can do in our own spaces should take the opportunity and leverage it to be able to do it, using the pandemic or whatever you need to use. But that's something I think we all need to hang on to.
In addition to all of these positive and inspiring comments, one of the topics that we wanted to get to was COVID-19 fatigue. And we more easily get to all of the things you're talking about by appropriately managing COVID-19 fatigue. So do you have any thoughts on that? And that's open to the group.
I can start. There's been a significant amount of fatigue, COVID-19 fatigue for us at the health department. And I think one of the things that we've learned is flexibility and just supporting each other. And so if there is something that a family member needs to take a few hours during a day to go do, or excuse me, someone who works at the health department or on the COVID-19 response team, that's supported. It's encouraged. We also really keep an eye out for each other and occasionally impose a day off for, like, you are taking a day off now, you know. So really looking and being that team has been something that has been very, very helpful. I think someone had mentioned humor before, and there's quite a lot of space for humor as we work together, even in a Zoom meeting. And we often will meet in small groups to be able to just talk through what's going on and be able to de-stress in that way. And so those are some of the things that we've been doing at the health department for our COVID fatigue.
You know, I have a legitimate concern that we're going to get to some point and I'm going to have missed the cue that it was time to stop being a little goofy in some of my emails, because we're very deliberate about that for the exact reason you talked about. And at some future point, somebody's going to say, Sneden, you need to be more professional. Well, we've tried to, I mean, that's one way, right? You try to help your team feel like they're going to get through this thing. And just like you said, we've tried to be very flexible and focus on the value of the team as such. I would say that in the case of the Greater Topeka Partnership, and probably all you would say the same thing too, this challenge has been part of the source of our courage as a group, because our mission, we knew that we had businesses out there that needed us. They needed a light to be on. They needed somebody to be keeping their eye on what was coming out of Washington, D.C. and helping them get through this. And when you know that folks are relying on you, that gives you, that might make you sturdier than it would in another context. So our mission gave us some pretty substantial bravery this year.
Yeah, I think one of the things we've really tried to focus on is supporting, staff, and like was said earlier about giving people a break. I gave that analogy of holding the water bottle out. Really what we're trying to do is just, when you've been carrying that so long, whether it's the backpack analogy or whatever, that gets really heavy. So, a laugh through an email, or, making light of something, it doesn't mean that we're not engaged in this challenge. It doesn't mean that we're not, working hard to take care of people, but we've got to have some time to recharge, or we're not going to be able to do that. The other thing is, we've been really trying to over communicate throughout our system, just numbers to call, ways to access help if you need it. If you get beyond that point where it's just having a laugh is not going to work, or spending time with family and friends, it gets to that other level where you really need to reach out and get some professional help through that. We just have tried to over communicate that, because I think it comes on suddenly, I'm doing okay, I'm doing okay, I'm doing okay, and then all at once I'm just not doing okay. And so research kind of shows us that sometimes that can happen very quickly, and to have access to that information is really critical. So we've had offered up a professional assistance line for healthcare workers. We put in place some of these things to get people immediate access to somebody to talk to and help them through that. We talked earlier about, growing through struggle, but that's only when you're at a point where you're have the supports to be able to grow through that struggle. When it becomes strain, that's not really one of those times where you're going to be able to benefit from that. And so I wanted to throw that out there, that there are a lot of resources out there. That's one of the things that have come from COVID too, is that there are a lot of resources out there for people to access. Thanks,
Thank
Mary.
you, Brad. Yes, in our last 3 minutes, speaking of humor and maybe the lighter side of things, if you would like to share something that you would like to do once we're on the other side of this pandemic, either personally or professionally.
I want to give TD Hicks a big hug. I miss that, period.
Top that, everybody.
Yeah. I look forward to not having meetings on Zoom all the time.
Oh, yeah.
And going out to eat, go to the ball games.
Dr. Locke, what are you looking for?
Yeah, I'm looking forward to seeing my brothers. I have a brother in New York and a brother in San Diego, and I have not seen them in about 1.5 years. So I am really looking forward to the family being back together again.
I hope that happens for you soon. And Dr. Anderson, what about you?
I would say connecting authentically with children in ways that we used to before the pandemic. Now you can't really hug or any of that. You have to be 6 feet social distance. And we give what we call air hugs. And so I'm looking forward to a time where air hugs aren't a common statement, and just hugs are what we give.
Yeah, I'm the same with you guys, being able to travel and be around friends and family in a more relaxed sort of atmosphere. It feels like there's always this thing kind of looming right now. But I'm looking forward to that. And hope is definitely such a motivator, more than fear, more than these other things that, we've talked about. How about you, Mary? What are you looking forward to? I'm going to flip it back on you here.
I would have to say travel without any of the stress or restrictions so that it feels completely free from worry. I look forward to that, both for me and for my family members. For sure. So we're going to wrap things up. Thanks to all of you. Just so much powerful insight and inspiration. Thank you for all you do for our community. I'd like to also invite our listeners to listen in at 6:30 tonight on KSNT to We Together, a Coronavirus Discussion. Dr. Cliff Jones, Stormont Vail Health President of Subspecialty Services, and Carol Perry, our Chief Nursing Officer, will answer questions about COVID-19. In addition, Dr. Richard Kennedy with the Mayo Clinic will share information about the science behind the coronavirus vaccines. I heard him speak earlier today at Stormont Vail Grand Rounds, and he presents a very succinct and understandable overview of the vaccines. So thanks again to everyone, and to our viewers, have a great night.